Thank you so much for joining us on the We Don't Play podcast show today, Mr. Emmanuel and Mrs. Chisorom Okwosa, and also Dr. Wale Olabi. Thank you so much for your time and being with us on the show today. How are you all doing?
We're doing great.
Great.
Doing great. Thank you. Thank you for having us today.
Yeah, anytime. You know, this is one of those episodes I'm so excited about because this is for the people. This is something people will listen to years from now, months from now, and they look back and say that this is a good cause for humanity. You know, I would love for you to also introduce yourself. Anyone can start on who you are, what you've done, and, you know, why this is such an important cause for you.
Well, then I'll go ahead and start. My name is Emmanuel Okwosa. I am the CEO of Africa Diaspora Health Foundation. My background is I'm a business person. I have an MBA and I'm retired. The goal of my organization is to continue to help people and to give back, especially in the health sector in the African continent.
Okay. So I am Chisorom Okwosa. I am a lawyer. I've been a lawyer for more than 40 years. I'm retired, and my husband and I decided to give back to Africa because we saw the need. By way of at least what we've done in the past, we've been part of medical missions for more than 20 years, actually 25 years, where we go back and help those we believe are in need with medications, with minor treatments, making sure we get a pool of people from US to volunteer their services to go back. So approaching retirement, we decided to give back in a more sustainable way. So we have a hospital that is US standard to ensure that services are provided in the utmost and safest and adequate environment. Okay?
Thank you.
My name is Dr. Larali Olabi. I'm a pediatric cardiologist in the United States, trained in the Houston, Texas area. On the personal side, I still continue to practice pediatric cardiology. I've been practicing for about 12 years now. I'm also the chief of cardiology for Hospitals for Humanity, and we are Hospital for Humanity is a non-profit organization that's established both in the United States and in Nigeria. And the goal is to provide pediatric cardiology services for children in Nigeria and other parts of the African continent as we can expand, and to provide the healthcare for those children because that's really expensive healthcare, and we want to provide it in a way that's both professionally given with international standards, but in an affordable way in Nigeria. So personally, my goal is to provide my service that I can as a pediatric cardiologist, and in the role for HFH, we want to provide as much care as we can for as many patients as possible, so that one child is not left without the inability to have a surgery because they can afford it. So that's the goal for HFH, and that's why we're here today. Thank you.
Wow. Thank you so much, all of you, for your service and for your vision. God bless you all, because this is something that a lot of people are scared to do because of, naysayers, and you know how things go. But, you've gone beyond that. You've gone above the threshold. You're looking back and you're looking forward too. So these are things that we are so happy to hear that are happening in our world today as well, which is why we're here to talk about also, the Gala, for healthy hearts and kidneys. I would love to even know more about the mission, because that's something a lot of people are very interested in understanding. Because when people know the mission, the vision, the idea, the core values, it allows them to understand what they're going in with. And with this cause, we'd love to know, how it aims to increase access to qualify people that have quality and affordable healthcare where less privileged Africans are around. How is this going to solve this problem for our community?
Okay, so Favor, before we answer that, I love that Dr. Olabiyi set out the goals for Hospitals for Humanity.
Yeah.
And I would like to also set out the goals for Africa Diaspora Health Foundation.
Yes.
Our goal is to ensure that everybody have access to good health care. And we focus in 3 major areas. One is in the dialysis. Dialysis is one of those areas that has become basically a pandemic in Africa, and we are providing free dialysis for those that cannot afford it. The other area is to ensure that authentic medications are given, which we ship United States medication back home and distribute it for free or at a very highly subsidized rate to those that cannot afford it. We can discuss that a little bit later. And we are also ensuring that everyone that we can reach can get a free medical consultation without charge, and also free eye check without charge at any time. Okay? So, and I'm going to let my husband then delve into the 2 organizations getting together and what our mission is.
Well, the mission of the Healthy Heart and Kidneys Gala is twofold. Number 1 is to raise funds to continue the hard work and the important work that the 2 organizations have been doing for many, many more years now in Africa. And number 2 is to create awareness of the work that we have done in Africa, in US. This is our first gala in US. This is our first introduction to the US environment. We want the US organization, community, entity, business entities to understand the importance of what we have been doing in the African continent. Now, having said that, we have these 2 organizations that have been mentioned, each organization doing their individual things for the past years. But as we want to do more to make sure that we reach more people, the 2 organizations decided to join hands together so that we can be able to do more for the continent, reach more people. When we're talking about healthcare is an important issue, and is also a very costly area in life. So our Africa Diaspora Health Foundation and the Hospitals for Humanity, we are both going to be doing a number of good work in Africa. As you know, they are responsible for making sure that young pediatric infants that are not able to live because of their heart conditions, they are making it possible for those individuals to be able to live. And so many of them, I'm sure, that they have done so many surgeries in the past that they will be able to share some of the work that they have done. Now, for the Africa Diaspora Health Foundation, we are an organization that basically decided that we are going to give to everybody that is not able to afford. To see a doctor you pay in Nigeria, to have a facility that is of standard, is very rare to have in Nigeria. We are making it possible to have that facility and to make sure that everybody that comes in there gets served, either at no cost or at a very limited cost. We have a number of services that we provide. However, for this gala, we are focusing on 2 areas. One area is to make sure that the dialysis epidemic that is killing a lot of young people in Africa and in Nigeria, that we are doing something to eradicate most of it. And also to make sure that currently, according to the Nigerian Health Department, 70% of the medication that is brought into Nigeria are fake. So therefore, through our organization, we want to make sure that we provide authentic medicine to people that are in need in Africa. And we are working with partners here in the United States to make that possible. We've been doing that for a number of years now, and we want to continue with the help of this Gala. Thank you so much.
Thank you so much. That is so good, and I love that, because this is what we need. And a lot of people don't know these facts, especially what you just mentioned about, the medicals and the prescriptions are not real. They are supposedly real, but you would know more than we do because we're only consumers. So, when people are advised by professionals, they take heed and they actually trust the person informing them. So when that mistrust and that misinformation is misaligned, then it creates problems in the future. So thank you so much for that insight. We wanted to also know too, what inspired you to focus on heart and health, kidney health specifically. When you look at the matters of the heart, the matters of the kidney, and what are some of the unique challenges that have been faced over time by individuals in Africa regarding these health issues?
I'll have Dr. Alabi go first on that, and then I'll follow.
Yeah, the inspiration is, our children, our young adults, providing care for them and providing care for them, what we've been doing individually before, but now trying to come collectively so we can do more together. Like has been said, there are a lot of, stepping stones and roadblocks and things like that in Nigeria and Africa in general. And those unique challenges in terms of getting proper medications, in terms of getting surgical equipment, in terms of getting consistent surgical and medical care. Those unique problems are unique more to the to Nigeria and African continent, and in quote unquote, the low and middle income societies. So because those problems are there, and we have those resources, we have that information, we have the knowledge from here, and we have a connection and ties back to home, taking the stuff and the information we have here and linking it back home is a desire for us, for both our organizations, to take the information that we know and the information that we've obtained here and use it in Nigeria, use it in Africa to better our people back there. It's all about giving back. We're giving these tools to whom much is given, much is expected. Right. So we've been given these resources and these tools, and we want to help to overcome those unique challenges to those low and middle income countries that we know that we come from. So that's where we start from, is working together to do great things.
Excellent. Okay, so what inspired my husband and I, particularly given that we have non-medical background, is actually a personal story. My husband and I have been married nearly 33 years, and we have 3 young children. 30 years ago, my husband had a renal failure from mosquito bite. And had it not been, which caused him to be in ICU for more than 2 weeks, in the hospital a total of more than 4 weeks. Had it not been that he was here in the United States, I would have been a widow after 3 years of marriage. So that was a turning point for us that made us start to give back. Like I mentioned earlier, we've been doing a lot of medical missions. And when we retired 3 years ago, we decided to make it a more sustainable medical mission. So that was our personal story, inspired us to do this. And in the past, the current data right now shows that 10% of African adults have chronic kidney disease. In Nigeria, as we speak, 1 in every 7 adults have chronic kidney disease. In a country that is the most populous country in Africa, with more than 220 million people. That is an astronomically high number. So that was why we decided to focus on kidneys. Now, in the average income in Nigeria is about $80 a month. Those that have renal failure are required to have dialysis 2 or 3 times a week at a cost of a minimum of $60 each session. That comes out to $180 a week. These are average income earners of $80 a month. You can do the math. A lot of people, and the data we have is that more than 50% of the 1 in 7. So that means for 50% of every adult with that is below age 45. So we have a lot of young people that are dying because of kidney diseases, which is caused by a variety of factors. There are lots of fake medications in Nigeria, for instance, that are causing organ failures. So that is part of the epidemic that we are having. So that is, and because the treatment for the dialysis is more than people can afford, that is the reason why we are deciding to focus on that. And then the second part of our focus is the medication, to make sure that we really get authentic medications to Nigeria and to other African countries. Now, part of the challenges that we are facing, beyond the obvious, which is the financial, is the fact that there are not adequate infrastructures or hospitals that are really adequate or up to US standard where these services are provided. So the 2 major challenges I would say are the financial constraints, where we are not able to do as many as we would like to, or reach as many people as we would like to, and then the infrastructure, the facilities in place are not up to the US standard. So, but we're overcoming it 1 patient at a time, and we're keeping hope alive.
This is beautiful. Thank you so much for that insight. And we thank God for life. And it's one of those things we don't take for granted. And it's not given. So having something like this is really important for people to see, and also tell a friend too, because information is power, but it's only powerful when it's applied. And this is information that is really good. So thank you so much for that. Some people don't even know the costs, at all. Especially now with the cost of an open heart surgery being about over $100,000, about $112,000 per child. Just the thought of that alone per child is just it's heavy. How does the organization, both organizations, how are you going to work together, to reduce this cost to a minimal fee that allows more families to benefit and also creates a positive impact, over the communities that we are serving?
I'll start from a part perspective, because you mentioned that $112,000 per child, and that's the cost of open heart surgery in a country like the U.S. is about $100,000, $112,000 per child. In Nigeria, the cost of open heart surgery, first off, is it available? That's the first question. Is it actually available, right? There are only like a couple of centers in the nation that actually do open heart surgery locally. Almost every other open heart surgery that is done by missions, where people are coming to the country still in this day. So that cost of open heart surgery in Nigeria is about $5,500, like $5,500 US. What we've worked as a Hospital for Humanities, what we've worked to do is to try to bring that down to about $2,100 or $2,100, because we're able to donate our time and we don't have to pay as much, pay our volunteers, because they're volunteering to come in. But there's still the cost of consumables. There's the cost of keeping the hot, the materials you're using, the bypass machine, the ICU care, all that. That's about at least $2,000. So there is for a family that makes, like we were talking about earlier, $60 a month to come up with $2,000 is still a lot of money to come up with. So what we've done as an organization and what we're looking to do is to raise funds through different means, and we've been doing that in Nigeria for quite a while, and now we want to do that over here in the US also. Raise funds, get awareness that this is going on. There is this high cost of surgery. If people have to pay out of pocket and they're not affiliated with an organization like us, they're paying $5,000. If they're affiliated with us, it's still $2,000. But then if we can get resources to pay for that, then it's $0 to them. So that's why we are bringing forth this information. We're trying to bring awareness into the community about what we're doing and what we want to continue to do to make this sustainable. Because that's what we don't want to do, the one-off missions. We want to make sure build a sustainable environment where we do the surgeries, we teach the people there, and they can also move forward and keep doing that even when we're not there. But we just build a sustainability, right? So that this is not just a one-off thing. And our goal is to keep doing this, forever and ever, and make things better.
Exactly. So likewise, the cost of doing dialysis is something that is just, it shocks the conscience, particularly in a country where the monthly or gross annual income is so low. So it is really very important for us to understand the dynamics of most African countries. There is no universal health care. It is hard to acquire insurance, unlike in the United States where you are able to, buy insurance, and then no matter what your condition is covered and you just pay your copay. We want people to understand that that is not the reality in Africa. So most Africans that get sick pay out of pocket. And when they are not able to pay out of pocket because they cannot afford it, they rely on relatives, they rely on donation, they rely on organizations such as ours, African Diaspora Health Foundation or Hospitals for Humanity, for help. So it is important to understand that, for instance, dialysis that you require 2 to 3 times a week, the cost of it, of just the dialysis, is about $60. That's not including the pre and post tests that need to be done. That's not including if you need blood transfusion, which a good 50% of those that are being dialyzed require.
It's actually more than 50%.
Exactly.
Yeah.
So if you calculate it, the actual cost in dollars is about $120. But again, because we utilize services of volunteers to do most of this work, we are able to keep that cost to about $60. So, and it's a situation where for a patient that requires $180, these monies are so insignificant when we are talking about it here, because even to do dialysis in the United States will run you about more than $800 a pop. But again, because we have all these volunteers here that are helping out, the organizations such as ours, we are able to keep the cost down. So in a month, it will cost dialysis of about 8 sessions, it will run you about $500. But the person, their monthly income is $60. So the reason why we are focusing on this is these areas seem to be the most expensive part of the healthcare that is given in Africa, and the frequency or the number of people with these conditions seem to have exploded in the past decade. So that's the reason why we are focusing on this and then trying to make sure we can make a difference.
Thank you so much. This is so good. You know, I believe now that people are hearing the cost, the figures, the thought, it's opening their minds up a little bit more because it's also new information they're acquiring. And I know they'll also want to do more research as well. So I think also to help them, it would be great to also hear some success stories or some testimonials from families, individuals, you know, homes, communities that have benefited from the healthcare services that have been provided over the time that you've been active. You know, are there anything that we can hear so that we can also enlighten some families listening?
Okay. Well, let me start off with one of the heartbreaking but success stories that we've had. We have a young lady by the name of Ijoma. She is 27 years old. She is a student. Last December, she was diagnosed with chronic kidney disease, requiring her to need dialysis to sustain her life. Ijoma's mom is her only source of support. Her father died years ago when she was much younger. Her mom, her actual income every month is less than $20 a month. Now, since December last year, we've taken on the case of Ijoma and we'll be providing free dialysis for her. And we have been also engaging her family's support, her friends and family for donation. Without this, Ijoma, without the dialysis, Ijoma will die. 27-year-old girl. So she is still doing well. The actual cure for dialysis or somebody who has a renal failure is to get a transplant. And transplants cost, even in Nigeria, more than 200,000 US dollars. So if she cannot afford it to do dialysis, that we're keeping down to $60 each session, she definitely is out of touch for transplant. But there's another success story. We have a gentleman he's 32 years old. He has a family of 2, and he too had a renal failure last year and has been dialyzing. So we have also taken on his case to provide free dialysis. But I cannot sit here and tell you all the success stories. I know that in the more than 3 years we have been providing these services, we have served more than 100 dialysis patients that we've provided free dialysis to. But if you go to our website, which is www.africadiasporahealthfoundation.org, you can listen to a lot more success stories of the help we have done. And I will let Dr. Olabiyi speak for Hospitals for Humanity.
Before Dr. Olabiyi, excuse me for a minute, I just wanted to add that with the dialysis issues, I'm not a nephrologist, but I do know that, some kidney issues can be resolved if you do the proper, dialysis once or twice or 3 times a week as you should. Some of those things can help the kidney bounce back and the patient will no longer be on dialysis. But the issue that we constantly and continuously facing with is that of funding. So sometimes instead of having 3 dialysis in a week, they can afford to have 2 dialysis in a month. When you're doing that, the kidneys would never recover in any way, form, or shape. So you are further really just damaging the kidney. And the chances of recovering is going to be 0, especially when some of our patients are coming in once a month, once every other month to do dialysis that is supposed to be done 3 times a week. So if you can salvage a kidney by doing the proper dialysis, you could save some of these people from actually coming out of dialysis and living a regular life without going through, a transplant. But if you don't have the funding, all you're doing is just delaying the obvious. You're delaying the obvious because every month you're doing a dialysis, you're just gradually sending that person to their grave. And if that's all they can afford, if that's all the funding that is available, that's definitely definitely where it's going to end. That person is going to die.
Excellent.
Well, that's really, really touching and really great stuff that you guys are doing in terms, because if your kidneys are not working and you don't get to it early enough, it can really cause lots of problems. Mm-hmm. From a pediatric cardiology, from a Hospital for Humanities standpoint, our website is hospitalforhumanities.org. Definitely they have more testimonials on there. So just one or two real quick ones. I can remember a patient, I believe his name was Favor, and had a condition called tetralogy of Fallot or blue baby syndrome. Some people call it that way in the layman terms, where a patient is born from birth with an obstruction in the blood vessels that go from the right side of the heart going out to the lungs. So if you don't have enough blood flow going to the lungs, then you don't have any oxygen coming back to the body. These patients can turn really blue and become really sick. Sometimes, if they go into a spiral called a TET spell, the patients can actually die from that. So we do have patients like this patient talking about where to eat, he would have to squat down to get blood flow to his heart so he could eat. So imagine going 9-10 years of life doing that, where you have to squat down to eat, because if you stood up, you can't breathe and eat at the same time. And then you have surgery, and we did surgery on him and opened up that blood flow to the lungs, and then you get this breath of life, right? And you've made this impact now. And now he can have a normal childhood playing soccer and running around and doing things like that, which wasn't a thought before because he just couldn't breathe. So that's a kind of impact where we bring a significant impact on a child where they were totally not able to do things before, and now they become productive members of the society. We can have other stories of children who, if they've not had surgery in the first few years of life, they would have passed away. And one particular one where they had the whole middle of the heart was missing. And if that continues for a long time, more organs get damaged. Kind of like what you're talking about, if you don't do kidney dialysis early, you can damage more things. In this situation, the longer that kid's whole middle of the heart is open, common AV canal, that heart and that body gets damaged further and further. But by us doing surgery on that patient and putting a patch in the middle of the heart, then now that heart is formed like a normal heart, and the patient can now survive and do better and even have a chance for any further surgeries in the future. So we on our website, hospitalsforhumanities.org, we have more success stories like that. And that is what your funds are going to go to, is to provide that kind of care for these patients that need it desperately.
Wow, thank you so much. These examples are so powerful. There's way more out there that people don't know. This is just a sample. It's like a litmus test, and people should just see that there's way more that beats the eye or meets the eye. And if we're keen, we can accomplish these things, with the people that we have available. So this is so good. Thank you so much for sharing that with us. I'm excited about, the gala, what the ideas are, the strategies, the events that will be happening on a yearly basis. And I'm also happy that I'm part of it as well. Part of Work and Play Entertainment and We Don't Play. We're excited to be here with you. We wanted to also know from you, what are the key fundraising strategies, events, that you've been able to organize to support your mission? How can listeners, the person listening right now, how can they get involved, contribute, participate? Where can they, even if they're not close, how can they add value to what the cause is for the better of humanity?
So, in terms of our fundraising strategies, the number one fundraising strategy that we have is actually letting our work show for itself. So we have good things that we have done over the years, and we want to let it show for itself. And how do we do that? By creating more awareness. We have made some inroads into Africa, into Nigeria, but really nobody know all the good work that we have been doing here in the US. As part of this gala is to make sure that we come in, we create this awareness, we show people all the good work that we have been doing saving lives in Africa, African continent. And a lot of times when we mention Nigeria, I want you to understand that because Nigeria is the giant of Africa, it's 220 million people in Africa, it becomes the most populous country in Africa. So when we mention in Nigeria, our work does not only limit to what we do in Nigeria, but also in the other part of Africa. So what we are doing, we have grant writers. We also have galas that we do. We go out to the communities and we talk to the people about what we do. We go back out to the some governmental entities like, we are a member of Chamber of Commerce here in Atlanta. So we become members so we can share the word and create the awareness in terms of the work we do in Africa, in this area. We have our websites that really when you go there, you're gonna get a lot of good information in terms of the work that we do. We are reaching out to local business entities or corporations, and again, creating awareness about the good work that we're doing, seeking for funding, seeking for ways that we can continue to do the work that we do. So we continue to save lives. When you look at everything that we're doing, especially the PDA open heart surgery, look at the greater people that are going to be our presidents, our senators, and our leaders of tomorrow. If we can at least get them to have a life, they won't be able to get there, without what we are doing. We're saving lives. Some people in the dialysis that are not able to actually have their kidney process their blood so that they can be able and do the filtrations in their system so that they can live normal life. If you can be able to get those people to have a normal kidney again, or to assist them in having some type of life going on by giving them, normal dialysis, I think that's creating more humanitarian efforts and letting people live, and then the medication. I cannot talk a whole lot about what happens in the Nigerian government or African governments, but I do know that, for us, we want to make sure that if we can have access to authentic medication so that our people, our kids, our fathers, our, people are not going to be failing their organs and things are happening because of the type of medication that they are taking. That's where we step in, and that's what we are doing. So essentially, we want our work to be our strategy on how we are going to continue. Thank you.
Thank you. So, and we, of course, have a gala coming up on October 26, 2024 here in Atlanta. And you can sign up. It's actually free, even though we expect some donation. You can sign up at Eventbrite. Just simply type in Healthy Hearts and Kidneys Fundraising Gala, and it will populate, and you can register there. So for those that are helping, this is our ask. We know that everybody is, have financial challenges, but we are asking people, if you can just chip in $19.99 a month and to our organizations, that will go a long way. So we have a Zelle account that is Healthy Hearts and Kidneys Gala at gmail.com. We also have a link with Zephy.com. Zephy is an organization that actually helps to raise funds without charging us any money. Unlike PayPal that charge 3% and all these other platforms that charge a lot. Zephy actually will give us 100% of the monies that are donated. And again, you can look us up under Zephy with Healthy Hearts and Kidneys Gala. We also have a bank account with Bank of America where you can wire. The account number is 334-062-07-8886. Again, let me make sure I'm saying that number correctly, which is the bank account with Bank of America is account number 334-062-078-886. Okay, so and again, also if you go on our websites, hospitalsforhumanity.org or Africa Diaspora Health Foundation.org, you will get a whole lot more information. We actually do have the link on there as to how you can pay or how you can donate. Okay?
And I just wanted to also mention that I know most galas are charging upwards of $500, $600 for a ticket to attend their galas. Well, this is our first gala that we are doing. And we thought that it would be best for us to show people what we have done. Basically, to let our work speak for us before we start charging for anybody to come to our gala. So that's the reason why that there is no ticket fee to come to this gala. However, we're also encouraging a lot of people to please donate if you can, because we need all we can. Our target actually is to raise $250,000 for this gala. And this $250,000 is going to afford us, hopefully, to be able to do up to 100 open heart surgeries next year in 2025, and up to 100 dialysis, and plus at least 240-foot containers of medication, authentic medication from the US to Africa. So please, we ask you whatever you can do to help us achieve our goal. We would very highly appreciate it. And everything that we get, and I want to mention this, most of our work, we use volunteers, people who provide their times. So administrative cost for us is very minimal. So most of the revenue that we receive from you and from everybody else goes directly to helping and servicing these kids and everybody else. And thank you so much about that.
Thank you so much. That is so good. And I know as you're listening, you're going to donate, you're going to connect, and you know where to find the links. It's in the show notes, in the description. Feel free to copy, text, screenshot, share, promote, connect, and let people know that there's something that's going for a good cause. And that is something I'm so excited about, that I know people here will also connect and also donate too. So thank you for giving, and thank you also for your service. In addition to financial support too, there are things that other people can do to assist, to help, even if they're in the local area. If they're listening, they want to say, okay, let me come and ask a few questions, see what they can also do to support. What other types of assistance or resources do you need that is needed to provide to ensure comprehensive care is taken, for the patients, whether they're coming from a local or from a regional or even international, point of view?
Well, there are a number of things in addition to the financial support that we're looking for. For example, dialyzers. If we have any entity, any organization that are able to provide us with dialyzers, And let me explain what a dialyzer does. Dialyzer is your artificial kidney. Dialyzer, bloodline, and guide wires. Those are the things that, because they are not manufactured in Nigeria, we have to import them. And that's part of the reason why the cost of dialysis go way out of whack, because we have to import those things from the Asian countries. So if we have any organization who are willing to donate dialyzers, guide wires, and bloodlines, and we can definitely talk to them and let them know the type of machine that we use, so that it's going to be compatible. As a matter of fact, we are using the Fresenius machine 2008 machine. That's a US machine. So if we can get free dialyzers from Fresenius, from other entities, DeVita, guide wires, or those things, those are actually going to cut down on the cost of dialysis that we are going to be providing to these people. So those are the things. And on the other hand, also, we have lab equipments, medical equipments, that if people are willing to donate something like that, we are more than willing to take those also, because we need all those. Anybody that is doing dialysis has to do pre and post lab and a number of other things that we provide. So any equipment that is still good, that can be used in Nigeria or in Africa, we would appreciate that as well. We're also looking for other machines like X-ray, mobile X-ray machines, other viable machines. Echo machines, all those type of machines, that if we can also have any agency that would donate those things, they will go a long way in also helping the cause of what we are doing and saving lives.
Okay. And if you want to donate, we would like to give you a telephone number that you can call. Call area code 404-482-1459, and we can coordinate your donation. Again, that number is 404-482-1459.
Thank you so
and
much.
Dr. Olabi, I am so sorry, Dr. Wale, can also talk about some of the items besides funds that Hospitals for Humanity might need.
Yes.
Yeah, I think you hit the key points on medications, equipment, resources. So if you're an organization or a company that has access to medications, to devices, to equipment that can take CBC, which is like a blood count, that can take blood screens and things like that. If you have any kind of connections to that'll be great. We've worked with organizations before, with companies before, that have donated equipment for us to use. A lot of it is small equipment, like the little bedside machines to check people's blood chemistry. So those kind of things are very useful and very essential. Right at the bedside, you can make an impact on a child's life. So that's one thing. We can also take donations for things in the cath lab. Talked about wires. We have devices that where we can go into the heart and close holes in the heart without opening the person's chest up. So the companies that do make those kind of devices, Medtronic, St. Jude, all those big organizations, we're willing and welcome to partner with you. If you do have any kind of resources or connections to those kind of organizations or hospitals that do those kind of our kind of surgeries, we are willing to partner, and we definitely would love to have those resources and those connections and take that over to Nigeria, Africa, and impact people's lives over there. So definitely, we're financial is great, but also you can also support us in lots of other ways. Hey, if you want to come volunteer with us, you can jump on the plane, come with us, volunteer with us.
That's right.
Exactly.
That's right.
Exactly.
That's right.
Exactly.
I love that.
So Yeah, and the other thing that is in the works for us is also we also are looking to create similar partnerships with U.S. Organizations here, so that we do recognize that there is also need, maybe not at the level as it is in Africa. We'll also like to address some of those needs to the extent we can here in the United States. So, but that's one of the things that we are in the works to, hopefully roll out by next year. But please, if there's any organization, we are here local in Atlanta, Georgia, that is interested in partnering with us. Again, please reach out to us. Our email address is africadha@yahoo.com. Again, africadha@yahoo.com. We also have the Healthy Hearts and Kidneys Gala at gmail.com. Again, Healthy Hearts and Kidneys Gala at gmail.com. You can reach us, send us an email at either of those emails, and again, we'll coordinate or take it from there.
Amazing. Thank you so much. I appreciate that. How about you, Dr. Olabi? How can people connect with you, and how can they get in contact if they need any direct access?
My personal email is, I'm just kidding, not my personal email. The Healthy Hearts and Kidneys Gala email at gmail.com is a great way to reach out and reach both organizations that way. Like I said before, the hospitalforhumanity.org, another great way to reach out to us from there. We have chat connections where you can contact us and you can reach out to us and we can go from there for anybody who wants to donate financial resources, any equipment, anything like that, or volunteer. That we have links on the page for that.
Amazing. Thank you so much. I really appreciate it. One more thing I want to ask, to anyone that can answer this, looking ahead, we've talked about the goals, the objectives, how it's going to work, just looking at the vision ahead, 2025, 2030, 2035, 2040, what are those long-term goals, and what would that one thing that you'd want to leave with the listeners today? They've heard a lot. There's a lot to process. So looking ahead, what are those long-term goals that you're seeing as an organization, and what could you leave with the listener so they can think about this as they're thinking about the coming years coming to us, based on health, hearts, and, the kidneys?
Yeah. So we want the whole world to know us for what we are doing, because we believe in what we are doing, and we believe in saving lives in the part of the world where basically there is no health care. It's not easy, and we go through a number of things trying to make sure that we meet those goals. We want the world to know about us. We are doing this in America. This gala is to introduce the services that we've been providing over the years here in the US. We want to continue to provide these services because the need is much. I'm not even sure that just the two organizations are going to be able to meet or alleviate some of the issues that we are facing in Africa today. But definitely, we are going to do our best. And we need your help. We need your donations in any form, shape, financially, otherwise, equipment, whatever it is that you can give us. Trust that is going to get to the point where people are going to be using it. We are saving lives. We are so proud that we are giving life to people that are going to be our leaders tomorrow.
And I know that 5-10 years from now, we want to be able to almost have a village of people that we have saved their lives, that will come out and say, if not for Healthy Hearts and Kidneys Gala, or fundraising efforts, or the two organizations, Hospitals for Humanity or Africa Diaspora, I would not have been here. So what we are wanting to do 5 years or 10 years from now is to make sure that we have enough infrastructure as much as we can all over Africa, that we can really saturate Africa with authentic medications, where people are able to afford authentic medications, which is the reason why more than 50% of the organ failures, that can be alleviated. We would like to see a continent of Africa truly that can be able to say, I can afford, or at least I have access to affordable health care, or at least free health care, where because of health condition or because I don't have enough money, I cannot afford. So that is our goal. So I think I mentioned earlier that my husband and I retired 3 years ago. Again, from our personal story, where we were lucky to be in a society that has good health care and good health insurance, where money is not the first thing you think about when you're wanting to access health care. Because of that, we've made it now our legacy project to try and get that to African countries. Our starting point is Nigeria. Again, as we talked about earlier, is the most populous country in Africa. But we have other countries that we are wanting to extend our tentacles in Africa. And with your help, we'll be able to do that. Again, just a donation of $19.99 will save lives. It will make a difference more than you think.
So yeah, for long-term goals, just piggybacking on what's been said, long-term goals for the Healthy Hearts and Kidneys Gala is to continue to do this and to grow from it. This is the first one we are doing. We want to have 10 more and then more and more, and work with other people or other organizations and work together. From an HFH perspective, we've done about 150 surgeries. We've screened about 1,500 patients already. 10 years from now, we want to have done 10,000 surgeries and screened 100,000 patients. And the way we do that is from people working together, from us coming together and going further and doing further, and then from you in the community joining with us and liaising with us to reach more people. And we want to also build sustainability so that this thing we are doing, even after we don't do it anymore, or we quit, or we are with the Lord for 100 years later, is we build sustainability where this is a sustainable thing, where people now know how to get good medications, now know how to get dialysis, or we build an infrastructure where dialysis is available, where there's an infrastructure for heart surgery for pediatric patients is available. So that's the long-term goals, is to work together and build sustainability so we can make a big impact on kids' lives in Nigeria and Africa.
I love that.
Thank you so much. And we are appealing to all the pharmaceutical companies, the Pfizers and the rest of them. If you're able to come across this, please, know that you can trust in us. We are working with other organizations here that we get our medication from to ship to Nigeria. We can also work directly with you guys. Please just let us know, and we're here. The plan is to continue to do this gala every year here in Georgia.
Amazing. Thank you so much for joining us on the We Don't Play podcast show. This has been one of those episodes I know that is going to last long, because people will hear this even next year, the year after, and see where it all started from. So I really appreciate your time today. We thank you so much for shedding this light on us, and we know that we'll tell a friend to come, in October, to make sure that they're also there physically and attribute to the success for the humanity that we're in at the moment. So thank you again. God bless you all, and we look forward to having you back on the show.
Thank you very much. Bye-bye.
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 Bye.